Hello. Today I am going to discuss about a question that appeared in the USMLE. A 22-year-old college student visits the emergency room complaining of excruciating discomfort in her right bottom quadrant. She claims that the discomfort began around 6 hours ago and has gotten worse over time. She doesn't have any serious medical issues, and the only prescription she takes is oral contraceptives. She engages in sexual activity with just her boyfriend. Her last period occurred 2 weeks ago. Blood pressure is 120/70 mmHg, temperature is 37 Celsius or 98.6 Fahrenheit, and pulse is 80 beats per minute. There is localized soreness in the lower right quadrant. A closed cervical os, exquisite sensitivity in the right adnexa, and clear vaginal discharge are all seen on a pelvic exam. The laboratory studies reveal that beta-HCG is negative, the leukocyte count is 7,300 mm3 and the hemoglobin is 14.0 gram per deciliter. The options are A. Acute appendicitis, B. Diverticulitis, C. Ovarian torsion, D. Ruptured ectopic pregnancy, E. TUBO ovarian abscess. The most likely reason for the patient's right adnexal-specific abdominal pain is ovarian torsion. She arrives with a sudden onset of right lower quadrant pain without fever or other laboratory indicators of an infectious disease, although having no substantial medical issues. When there is additional ovarian pathology present, such as a cyst or other lesions that cause the ovary to twist upon its vascular supply, ovarian torsion frequently occurs. When there is no blood flow to the ovary, ovarian torsion can be immediately identified by pelvic ultrasonography. Surgery is needed to re-establish blood flow because this diagnosis requires immediate attention. Now let us look at different options here. Choice A is acute appendicitis. Acute appendicitis is an infectious condition brought on by bacterial infection once the appendix is obstructed, often by a fecalith. Leukocytosis, fever, and pain in the right lower quadrant are typical symptoms. The possibility of an appendix rupture is increased by the presence of peritoneal symptoms such rebound soreness. So, option A is wrong. Choice B is diverticulitis. An infectious condition known as diverticulitis often affects older adults with diverticulosis. Diverticulosis can happen anywhere in the colon, however it most frequently affects the sigmoid colon. Diverticulitis symptoms include lower abdomen pain, fever, nausea, vomiting, and leukocytosis. So, option B is wrong. Choice D is ruptured ectopic pregnancy. Any pregnant woman who exhibits abdominal discomfort, vaginal bleeding, shock symptoms must be diagnosed with this condition. This is another surgical emergency. If the doctor fails to diagnose, the patient will die. A negative serum beta-HCG result for this patient eliminates the likelihood of an intrauterine or ectopic pregnancy. So, option D is also wrong. Choice E is TUBO ovarian abscess. An advanced case of pelvic inflammatory disease, or known as PID, is called as a TUBO ovarian abscess. It is most frequently brought on by anaerobic bacteria that have moved from the lower genital tract. Patients who have early onset of the first sexual experience, having several partners, having a history of a sexually transmitted disease, and douching are risk factors for PID. PID and TUBO ovarian abscess are more common in women who use intrauterine devices for contraception. Pelvic pain, a fever, leukocytosis, and unusual cervical or vaginal discharge when PID is present are signs of a TUBO ovarian abscess. Some helpful tips to remember is that a presumptive evidence of ovarian torsion is the abrupt development of significant lower abdominal discomfort in the presence of an adnexal mass. To confirm the diagnosis, ultrasonography is utilized and beta-HCG should be negative. That's it for this question. As usual, please like, comment and subscribe if you find this video useful, as this will motivate me into doing more videos like this. Don't forget you can request your biology or medicine topics via the Google form that is linked in the description below. Thank you and see you all in the next video.